With introductions, you see James Freeland. He is a veteran employer liaison in the San Antonio area, along with Lori Pimentel Johnson, who's our district outreach coordinator. So that being said, I'm going to turn it over to Beth, who will present or start showing the presentation, and then have Luis kick off the showcase.
All right. Well, good morning, everyone, and Happy New Year. Welcome to our presentation today. My name is Luis Sepulveda, and I'm also a veteran as well. And we want to just kind of go over some things that we're going to be talking about today. We're going to be speaking about our Christus Health and our DoD program that we have for the SKILLBRIDGE. We're also going to be talking about the ministries that we have, and also some of the positions that if you're not on active duty and want to apply on the jobs that are open at the moment, then we'll be explaining about how to go and take those steps and those opportunities. I'm going to go ahead and turn it over to Beth, and she's going to go ahead and give us a little bit of history about Christus, and we'll move forward from there.
Good morning, everybody. Sorry about that. My name is Beth Wood. I am the Program Manager of Talent Acquisition with Christus Spohn down here in Corpus Christi, Texas. Again, thank you all so much for hosting this today. We are very honored to partner with you all. Such a wonderful organization. A little bit on Christus Health. My apologies. In 1866, Texas was an incredibly large state, as we all know. It takes about 8 hours to get across. It was on the brink of growth. The entire state was under a single Catholic diocese, with Claude Marie Dubois, shown in the top left, as serving as bishop. He traveled over from France, and while he was here, he came into contact with many diseases, illness, and poverty. He called on his native France and his friend, Mother Madeleine, to send over some sisters from France to help with the growth in the state and to serve the state. 3 nuns traveled over from France and landed in Galveston in about 1867, where they founded the original and first Catholic hospital in the state. They landed in October of 1867, and in May of 1869, they were called to San Antonio. There was a cholera outbreak in March of 69. When they arrived, unfortunately, they had discovered that one of their buildings that they would use for the hospital had burned down. But they persevered and were able to open Santa Rosa Infirmary by the end of the year. So that's a little bit about how Christus Health in general has gotten started. In 1999, to strengthen our ability and our reach to those in need, we merged with 2 systems to become Christus Health. We do serve a greater population than just the state of Texas, which I will get into in just a moment. Our mission is to extend the healing ministry of Jesus Christ, and our core values are dignity, integrity, compassion, excellence, and stewardship. We are a Catholic not-for-profit system made up more than 600 centers, including long-term care facilities, community hospitals, walk-in clinics, and other health ministries. We're a community 45,000 strong, with over 15,000 physicians providing individualized care for us. So our locations that reach 45,000 strong, that's a lot of people. We are all throughout the state of Texas. If you look at the map, we're in Texas, Arkansas, Louisiana, New Mexico. We're also international. A lot of people don't realize that we have international opportunity as well. We're in 6 states in Mexico. We're also in Chile, Colombia, as well. Our system headquarters are located in Irving, Texas, and where I sit in Corpus Christi, we call ourselves the Christus Spohn Ministry. So in Christus Spohn specifically, I'll move to the next slide. We are comprised of 5 area hospitals, 2 here proper in Corpus Christi. We have Christus Spohn Shoreline, which is the bottom right-hand picture. And then we also have Christus Spohn South. A little bit about Christus Spohn Shoreline. It is the southmost acute, highest level of acuity facility in South Texas. It is a level 2 trauma center. We see most of the areas and most of the coastal bend trauma cases. So anything from GSW to a collision, it happens at Shoreline. All adult cases here at Christus Spohn South. This is on the south side of town. If you're familiar with Corpus Christi, the census is growing. We are currently expanding our ED from a 12-bed ED to a 24-bed ED, so literally doubling in size. And this is also where our mother-baby units are located. So we have OB/ED, labor and delivery, postpartum, nursery. Our total joint program comes out of this facility as well. So any major hip replacement, knee replacement, that is where this will take place. And then in our surrounding communities, Alice, Beeville, and Clayburgh, we have community hospitals that serve those rural areas as well. We also are comprised of 7 family health centers located in the area as well. So more of your routine preventative care, and those are located in Corpus Christi, Aransas Pass, Robstown, Padre Island, Beeville, and Kingsville. And there's opportunity there's on the clinical side, on the administrative side as well. We are also consistently ranked as a healthcare leader in the area, and we've received national recognition for pioneering programs. Shoreline itself is an 8-year stroke accredited facility, and we're currently seeking, hopefully, fingers crossed, at the end of this month will be a level 1 trauma center. It's a designation we've been seeking for quite some time. Let's see. And I'm going to pass it back over to Louise to talk about the SKILLBRIDGE program.
Thank you, Beth. You did an amazing job presenting our core values and our history with Christus. So I'm going to take it over now and explain a little bit about the SKILLBRIDGE program that we have here at Christus Health. We, just to kind of give you a little bit of feedback for those that don't know about the SKILLBRIDGE here at Christus and anywhere else. This is for active duty service members that are looking at doing an internship with a company, and specifically with us would be more in the medical healthcare industry. So if you're on active duty and you're searching to do a SKILLBRIDGE internship program, we have partnered up with the DoD department, and we are sponsored and part of that. So if you're wanting to do that, as long as you have 180 days or less, of course, then you would be able to do that internship, SKILLBRIDGE internship with Christus Health. Some of the positions that we have available are clinical and non-clinical. So if you're looking, or if you're already a nurse and want to pursue your civilian career with Christus, we have those positions. We have also other positions that would be non-clinical. So if you're looking at doing maybe materials management, logistics, customer service, finance, or information management, and many other positions out there, we're definitely welcome to speak with you and to see where you would have that good fit with Christus Health. Next slide, please, Beth. So we started back in January of the 29th of January of last year, and that's when we went live with the pilot program that started out in San Antonio at the Children's Hospital. From there, we, of course, built the platform and everything to support the SKILLBRIDGE and our service members coming into it. We had our first associate that was an HR background in the Air Force and came on as a SKILLBRIDGE associate, started on May 9th. Since then, she has transitioned into a full-time position in the Human Resources Department. So that just shows that not only are we trying to help service members come in, experience our culture, but also use their whatever they've already learned and their talent and bring that into the Christus culture, and then also learn other things that she didn't know about other systems or how things work in the civilian sector. So once she completed her SKILLBRIDGE assignment, then of course we saw the talent that she had, and we reached out and able to hire her on as a full-time associate. So right now, currently, we have 19 SKILLBRIDGE associates going through the internship program. We have, since we've started, hired on 7 new SKILLBRIDGE associates to full-time employment. We have 14 candidates now that will be starting as a SKILLBRIDGE associate between now and June 20th. So we're definitely growing, and we're getting more service members interested to come to Christus Health and participate in the SKILLBRIDGE program. So of course, the SKILLBRIDGE associates, the way when they come through, we treat the service members as if they were a associate coming straight into the hiring process. So you'll get the experience, what it's like to go through the onboarding, the orientation, maybe having a disc assessment. And then some of the positions that we have already filled through the SKILLBRIDGE are patient care techs, registered nurses. We've placed people in the supply chain. Also, we've had a radiology tech assistant, unit clerks, EKG techs. We also have had and currently have one is a registered respiratory therapist. We have several HR assistants and many other positions that are available for the service member to go through and experience and get trained up on some of these jobs. We do have entry-level position jobs. So for any service members that are looking to transition from the military that don't have medical skills but have always wanted to get into the medical industry, we do have entry-level positions where you could come in and start learning how to be like a patient care tech, for instance. That's a good example to use because it only requires a high school diploma and having a BLS. So your basic life skills license or certificate. And then you would go through the training and actually learn how to assist patients and do the day-on-day things. So for any service members that are aspiring to be nurses, that's a great entry-level step to take to be able to get your foot in the door in the medical health community. Next slide, please, Beth. So for the veterans that are looking to get hired on directly, this is the website to go to. So if you want to take a picture of this, and I believe we'll have the slides live later on, but that's where you would go to careers.christushealth.org. And that's where you can apply directly for any of these positions that you see and many others. So again, we do have clinical positions and non-clinical positions that support the medical staff. So I'll kind of just pause there for a second and let you either jot that down, take a picture of it, but that would be the website that you would go to and apply for these positions. So the next steps, if you are interested in doing the SKILLBRIDGE internship with Christus Health, you would go to our website, and this is a different website that you would go to, and that's the website there where it's careerschristus.org /SKILLBRIDGE. There you would fill out an application and put in your information, where you would like to be, maybe what ministry you would like to go do your SKILLBRIDGE assignment with. Once we receive that, then one of our SKILLBRIDGE recruiters will actually reach out to you and have a phone conversation with you to find out where you'd like to go, what kind of positions you're interested in, what your background is, and what you're wanting to either learn, or if you want to continue the same career that you have in the military, to just continue that with Christus Health. So at this time, also, I'd like to introduce Rick Garcia. If you would mind sharing your camera. So this is Rick Garcia. He is the SKILLBRIDGE recruiter for the Corpus Christi area, and he will be your point of contact in the Corpus Christi area. So I'll let him introduce himself real quick.
Okay. Thanks, Luis. Just like Luis said, I'm the recruiter here for Corpus locally. I'm a veteran myself. So again, if you go to the website that's listed there, that goes to like a centralized location. We have someone that looks at all the requests that come in, and then they assign it to the appropriate individual. So if you are interested, if you're still active duty, I would encourage you to start, your application, at least 9 months out, because there are a lot of steps that you need to go through. There's approval processes that you need to gain through your command before you can come to us. Again, you need an approval on that side and approval on us. And again, we're trying to take you on for the full 180 days if we can. But at the least amount of time that you can do, and Luis can correct me if I'm wrong, is 2 months. We won't take anything less than 2 months. So hopefully, you're within that window. Again, if you have any questions, reach out to, again, myself or Luis, especially myself, if you do want to come to Corpus, because I will be able to tell you the steps that you need on your end in order to start an internship on ours. Again, if you have any questions, feel free. I'm not sure if you can come off of mute or at least ask it in the chat pod. I know there was a question in here about an entry nurse level position, and I would think that's something that Luis could answer.
Thank you, Rick. Appreciate that. Yes, we'll hold all the questions to the end, please, and then we can do a question and answer as well. All right, thank you, Rick. Appreciate that. We'll continue with the slides. So okay, there we go. Our goals is to increase more veteran hires and be able to bring in more veterans and to offer veterans more positions through Christus Health. We are currently expanding, so not only are we, of course, San Antonio area, Corpus Christi area, we're also expanding to the Tyler, Texas area now for the SKILLBRIDGE program, and then by next month, we should be expanding out into Louisiana as well. This is our website for you to go to. Again, all you'd have to do is just click in there, and if for whatever reason you don't get a chance to write this website down, you can always just Google SKILLBRIDGE at Christus Health, and this website will come up. You just fill out that application, and then a recruiter will be reaching out to you shortly. All right, next slide, please. So this brings us to the end of our presentation. We have, again, the SKILLBRIDGE there. If you need the other website to go on and apply for the jobs that are already open, we could probably put that in the text as well, so you'll have that available to you. Again, my name is Luis Sepulveda. You've already met now Rick and then Beth as well. So we're excited to help out any veterans that are looking to come onto our team. Thank you for your time, and God bless.
Wonderful. Thank you, Luis. That is some great information. And so as you can see that Rick pointed out that about that entry-level nurse position. Can you expand on that, please?
So yes, we do have several entry-level positions. That one that I was talking about specifically is a patient care tech. That one, if you have a little bit of medical background, is definitely preferred, but not required. It does require a high school diploma and the BLS as well. So that's it. That is something where you're helping and you're helping out an actual registered nurse. So for us as a SKILLBRIDGE associates, for let's say a military person that's coming on board that has no medical background, that is a great way to start your career in the medical health care. So you would come in, you would assist a registered nurse. That gives you the opportunity to ask questions and how did they get to the point of being that registered nurse? What courses do they need to take? What licenses do you need to acquire from there? What other steps can you go from being a patient care tech to registered nurse in between? Let's say you could get your LVN license and then promote into those positions until you become that registered nurse. The beautiful thing about Christus Health too is we have our own nurse residency programs. So you could do your career full blown all the way up to becoming a nurse. And Beth would probably be a better advocate to speak about our nurse residency programs that we have there in the Spohn area.
And I'll just expand, if I may, on the nurse residency program. It is a wonderful program. It's a full year with clinical orientation and clinical education supports. You precept, which is essentially you shadow a licensed nurse just after you've graduated on the unit that you're hired on. And you work under them for 3 months until you're competent and confident in your skill set and are able to take your own patients. That is not exclusive to Christus Spohn. That is any hospital, any ministry. So throughout Texas, Louisiana, we offer residency positions in all of our facilities. Now, specialty will vary facility to facility. You know, San Antonio has the Children's Hospital of San Antonio, so you could start your career as a new nurse in pediatrics. You know, we have at all 5 of our hospitals here in Corpus Christi. So it's a great way for any nursing student that has completed their education, they've obtained their RN license through the state and passed that pesky little test called NCLEX.
Yes, yes,
that is
yes.
the bane of so many's existence.
Mm-hmm.
You know, we're committed to helping bridge that education practice, you know, the classroom setting, and as we call in the field, hand to patient for the first time, because that's a big deal. You've been very protected with your institution for 2 or 4 years. And starting as a new nurse, it's an organization's duty and commitment to make sure that you are able to practice to the top of your license. And that's what a residency does. Not all facilities and organizations offer a traditional residency program. Evidence-based practices do prove that the more support new grad nurses have within their first year, the more successful they are.
Okay, great information. So one of the our counterparts are veteran career advisors who work with transitioning veterans, military spouses, veteran spouses, whenever they're working with those individuals and they are, of course, developing a resume. Is there anything specifically between Rick or Luis that you look for as far as the resume itself that'll kind of help them pretty much give them a greater opportunity in landing an interview?
Yes, on the resume, I mean, I think we can't stress this enough across the board for military members is try to take out as much military language in the resume. There's so many different organizations. Texas Veterans Commission is one of them that will help you tweak your resume to the civilian sector as far as communicating. So because some people might not have that military background, they might not understand talking about this. Other things that when you mentioned you were stationed at, let's say, Okinawa, Japan, and you did these, whatever you did, your duties were at that duty station. Yes, the place and location is great, but try to be more concise on less military stuff that you did and more and how that translates over to the civilian sector. So those would be my big points as far as also when you do your resume, a lot of people like to use the chronological order, of course. Mm-hmm. I would put your most current position and what you've held and try to put down years of experience, because that's one thing that recruiters definitely look at right off the bat is how many years of experience do you have, even as a patient care tech, entry level, or how many years experience do you have as logistics and doing supply and chain, and then explain what all you've done to support that that job that you have. So instead of saying my MOS was, my job was a supply logistics officer or a supply to logistics, what have you, and then elaborate on that. So definitely have other eyes take a look at it. The more people can take a look at your resume to tweak it, I would highly recommend that. And also just be open to feedback, that good criticism. So that way they can, because we're all here to help you attain those jobs and help you transition over to the civilian sector. And it takes a little bit of getting used to going from the military. Practice your interviews. I highly recommend practice your interviews with as many people as you can. There's LinkedIn is very, very good, a good source. And YouTube. Don't be afraid to use YouTube and look at LinkedIn, interview skills, interview advice on how to perform that interview.
Yes, we definitely have a great core of veteran career advisors that just definitely works with veterans that exactly what you just discussed. Also, what could be the guesstimated turnaround time whenever a veteran applies for a position? Now, I know there's no set time, but is there a guesstimated time where they can receive some kind of feedback?
Yeah, absolutely. So expected turnaround time, if you apply directly to a position on the Christus Careers website, a recruiter will reach out to you via email or phone call within 2 business days. That is our promise. So they will reach out to you. You'll receive an email that a recruiter has reviewed your application and would like to talk to you about your qualifications and the position. Or they'll say, you're lacking some experience. Please, take a look at other positions. We're considering other applicants. But if you do receive that we're interested email, a recruiter will ask you, please provide 3 dates and times that you're available to speak, and they will give you a call. They'll do a quick phone screen, which usually takes anywhere from 15 to 30 minutes, just speaking on your experiences and really trying to navigate that best fit for you. After that phone screen is completed, the recruiter will submit your application to the hiring manager if they do feel like you're a good fit. And then we do ask same level of commitment from our hiring managers and our clinical directors for a 48-hour turnaround on feedback, whether they would like to move forward with the applicant, whether or not they'd like to consider applicants, and if they'd like to interview. A lot of times directors will reach out directly to interview, or the recruiter will reach back out to set up that interview. We are able to accommodate both virtual and on-site interviews. Of course, on-site always gives the candidate and the director the best feel and the best fit for the organization and also for the candidate. So in a perfect world where everybody can get a hold of everybody,
exactly,
within that 48-hour turnaround, sometimes there's some phone tag between recruiter and candidate, or candidate and recruiter, or and clinical director. But we ask our directors to also stay within that 48-hour commitment. Once you're in the interview process, it might be an interview or 2, initial interview with that clinical director. And then also our directors do usually buy into the feedback of their teams. And so most of our directors have candidates come and sit with for a peer interview. And usually at that time, they will follow up and come to their decision, let the recruiter know, and then we're at offer or letting somebody know that they were not selected. And at that time, if there's other positions that they'd like to consider, we'll work our hardest to find a best fit.
Oh, that is awesome. Totally awesome. Appreciate that. We do have another question, and I think this can pertain to Luis and Rick. Is there, well, since you are veterans yourselves, will you be able to assist in reviewing the resume to ensure military terminology is correctly translated prior to applying? Will you be able to view resumes, or is that something that you can do or cannot do?
Yes, by all means, we're here to help out veterans. We love our military community, and being veterans ourselves, we have been through that path of transition and have had those hurdles. So we're more open to help out. Even though we're SKILLBRIDGE and working with the active duty component, we're here to help out any veteran that needs any assistance with resumes. So at that point in time, you could either still send us a message through the SKILLBRIDGE website, and just in the notes there, put I'm a veteran needing help with my resume, what have you, and we'll definitely reach out to you and look over your resume and then maybe give you some pointers on that and that sort of thing. So hopefully that would help out. But yes, we're here to help out our veteran community. We do hold throughout Christus, we have a peer group. So once a month, the SKILLBRIDGE associates meet. And then we also, where we have more like a resource group, if anybody's needing help with like trying to do their VA claims and all that sort of stuff. And then we're also growing that with the veterans throughout the community. So yes, anything we can do to help out, by all means, please reach out.
Hey,
Thank
James.
you. Yes.
James, this is Rick, and I just want to piggyback off of what Luis was saying. There's a document that all military personnel can get. It's called the VMET. It stands for
yes.
Verification of Military Experience and Training. It does convert all your training and education that you've gotten in the military, and it converts it into civilian language. Again,
Okay.
it's called the VMET. It's on MilConnect. You can try to locate it. If you can't locate it, all you need to, you can contact me, provide me with your DOD ID number, and I can get you your VMET,
Okay.
which will probably help you at Texas Veterans Commission. If you're going to sit down with someone and help them out, it's going to, again, convert all their MOSs or their AFSC or, rate, whichever service you're in. It'll convert it to civilian language to help the individual and the person that's helping them with the resume.
Oh, that is awesome. That is awesome. And then, of course, considering some of the significant barriers of employment that we work with our veterans, we do have some veterans that we have categorized them as justice involved. Now, is this something that, possibly with a cover letter that can explain, or how would the process work with veterans that do have backgrounds?
So Christus Health does have, of course, like I said, anyone coming in, whether it's going through SKILLBRIDGE or a direct hire, we do have a background check, of course. So that is something that is part of the onboarding process. So that is one of the things that they'll do once they fill out the application, and they're going to be getting hired or brought into the SKILLBRIDGE assignment or internship program. The background check will be done. If, let's say, something negative comes back or whatever, at that point, HR would probably get involved and give us guidance whether that situation, is able to be, I guess, waived in a sense, or that it would either affect or not affect employment.
Perfect. Thank you. Thank you. And then lastly, whenever we have these veterans transition out of service, of course, more likely some of them do go to home of record, or they stay put. Like I did when I retired, I pretty much stayed here in Corpus. If they do decide to switch over from, I guess, relocate from San Antonio to the Corpus area or vice versa, does Christus provide some kind of relocation allocation?
No, we do not provide any kind of allocation for relocation. However, if you're looking to do a relocation, let's say you're there at Corpus and you decide, maybe there's opportunity, or kids are moving to college and going to Dallas, and you want to follow your kids in Dallas, as an example. The process for that is, so we have two boards. We have the external board where everybody has access to come in and look at our open positions. And we also have an internal board. So in that internal board, that's where you would apply to those positions wherever you would like to be relocated to. And then once you've gone through the whole process, the interview, acceptance, and then they finally give you an acceptance letter, then at that point in time, they would let you know, okay, by when you would need a report from let's say Corpus to Dallas or any other where else you would like to go.
Perfect. Thank you. And I'm glad you said that, because that was going to be one of my last remaining questions, but that is awesome. Truly answered it. So do we have any other questions within the chat room?
Hi, James. I just wanted that poll that I sent out, if anyone can respond that has not so far, and on the other responses, they can just, quickly put in the chat how they heard about it, about today's event.
Got you.
Thank you.
All right. Well, I don't see any other questions. So with that being said, if Rick and Luis and Beth can turn their screens back on. So I definitely want to thank you for participating in this event, and of course, another organization that advocates the hiring of veterans and military spouses and spouses. So that is definitely awesome. Myself and all of the TVC personnel within your area definitely looks forward to working with you. And I know that, and speaking on my behalf, I guess I'll be working with Rick, since he is in the Corpus area, and James with Luis, that whenever we have, certain situations that come up or any issues come up with our veterans that are interested in the positions, we can reach out to you. And of course, our veteran career advisors that has any question pertaining to Christus Health, myself can reach out to all three of you, and definitely looking forward to working with you. And of course, we will be asking or trying to invite you to any upcoming career fairs. And so that way, if we do have a veteran, we can introduce you to them. And then, of course, fill your ranks up with veteran soldiers and military spouses. But other than that, again, does anyone have any last minute questions that they might want to ask before we wrap this showcase up? Okay, we do have one question from Lori. She said, are you open to LinkedIn virtual introductions to veterans and family members that have interest?
I'll speak on this if y'all don't mind. Yes, absolutely. We're always on LinkedIn promoting where we are, what we're doing in the community. But also, algorithms are fantastic. I actually placed an entire family. The husband, he was retired military, and they were relocating from, I believe he was Navy. They were relocating from San Antonio down to Corpus Christi, and he popped up on my LinkedIn feed one day that he had been accepted, him and his daughter, to Del Mar College's nursing program. So I reached out to him, just said, congratulations. If you are interested in opportunities in the Corpus Christi area or just have questions about Corpus Christi, I'm a native, would love to connect with you. So ended up connecting with him. He is now a driver for our shuttle service here at Christus Spohn,
nice.
While he's attending nursing school at Del Mar. And then his daughter just accepted a unit secretary position, and she is in nursing school at TAMUCC, and his wife is actually a registered nurse, and she accepted a position with us this summer on our acute neuro floor at Shoreline. So it's all in the family.
Nice.
So
nice.
yes, please send LinkedIn. I'll drop mine in the chat. We're very active on LinkedIn. I see Lucas on it all the time as well. So please connect with us on LinkedIn. We're always sharing and available to chat.
Perfect. Thank you. Are there any additional last minute questions? And okay. Well, thank you for coming out. That concludes this showcase. Again, appreciate your time with sharing this information with a wonderful organization. And again, that concludes our employer showcase. Thank you, and hopefully see you soon.